So chief complaint is shortness of breath. This is a 70-year-old female who's seen by both primary care and a pulmonologist with a history of COPD on 2 liters of oxygen around the clock at home with a previous hospitalization for COPD exacerbation. She's never been intubated. She's an active smoker on no oral steroid therapy, and a further history of CAD with status post-MI with PCI in 2010, maintained on Coumadin, hypertension, diabetes, maintained on insulin, presenting with shortness of breath that started 2 days ago and progressed gradually, associated with intermittent dry cough, fatigue, denies any fever or sore throat, chest pain, palpitations, nausea, vomiting, diarrhea, or abdominal pain, denies history of DVT or PE, leg pain or swelling, or recent periods of prolonged immobility. Past medical history is positive for the COPD, CAD, MI, PCI in 2010, diabetes, and hypertension. The past surgical history of appendectomy and a total right hip replacement. Medications include albuterol, metoprolol, Lipitor, and Coumadin, and insulin. Allergies include penicillin, which cause anaphylaxis. Social history is positive for active smoking, but denies any alcohol or illicit drug use. On physical exam, the vitals show a heart rate of 105 beats per minute, blood pressure of 175 over 95, respirations 20, temperature 99.5, and a pulse ox of 90% on 2 liters nasal cannula. In general, the patient is alert and oriented, ×3, and no acute distress. Ear, nose, and throat demonstrate no pharyngeal erythema or tonsillar exudates. Neck is supple. Lungs demonstrate wheezes and rhonchi bilaterally. Heart is tachycardic but without murmurs. Abdomen is soft and non-tender, non-distended. Neurologically, there are no neurologic deficits. Cranial nerves 2 through 12 are grossly intact bilaterally. 5 out of 5 muscle strength in all extremities. And sensation is intact in all extremities as well, in normal gait. Extremities are non-tender and non-edematous. Differential diagnosis includes COPD exacerbation, CHF, pneumonia, PE, pneumothorax, and ACS. I'm ordering a CBC, a BMP, a BNP, a cardiac profile, an EKG, a chest x-ray, and a CT angio of the chest. Therapeutically, I'm giving Duaneb treatments ×3 and oral prednisone 60 milligrams. And I'm also placing the patient on 2 liters nasal cannula. Ma'am, I'm Dr. Carlson. I'm the resident working with Dr. Matisse. He's the attending physician. Our nurse is Carmen. If you have any questions or need anything, press your nurse call button. We're going to be getting some lab tests, an x-ray, a CAT scan of the chest, and you'll be receiving some medications through a nebulizer. The lab tests take 1 to 2 hours to get. The x-ray takes about 1 hour to get the x-ray and get a radiologist to read it, and the CAT scan can take up to 2.5 hours. I'll come back in 10 minutes to see if the breathing treatments are helping you. If you have any questions, please hit your call button.